from the station that's on your side. This is Channel 7 News Daybreak.
Welcome back, everybody. 6:23 is the time. Recent studies indicate that approximately 7.5 million people yearly go to the doctor's office for a shoulder problem. You could be one of them. Baptist Health Dr. Devon Ballard with the Sherwood Family Medical Center is joining us here to talk about how you can take care of it. Dr. Ballard, good to see you.
Thanks.
We were just talking in the break, laughing a little bit. Shoulder surgery,
yes.
Shoulder issues. It seems to be almost, unfortunately, the norm as we get older these days. Let's talk first this morning about causes, and I know there's probably a lot of different ones. What are the most common causes you see of shoulder pain, though?
Usually it's a repetitive type motion, so, overhand throwing of the football or baseball, or painting, because people are usually doing things above their head.
Yeah.
Let's say you're moving and having to clean out the cabinets, and your hands are doing repetitive motions above your head. Or we're doing things like we talked about that we used to do when we're, like my son, he's 10, playing baseball. Well, some of the 35 to 45-year-old men and women play baseball, softball like they were 10, and there's some injuries that occur when that happens.
Yeah, don't heal as fast as we used to, right? Yeah, it gets to a certain point.
No doubt.
And unfortunately, for a lot of people out there, they don't realize it until it's too late. They think they can still do it, and unfortunately, you just can't hold up.
Exactly.
Symptoms. What are some of the symptoms people can, for more serious shoulder pain?
Classic. The main. There's so many injuries you can have with shoulder. The main things like rotator cuff.
Yeah.
Hear about rotator cuff injury, tendonitis. Most people have night pain.
Really?
Pain with overhead maneuvers. So I always tell people, think about having a piece of glass on your shoulders going both ways.
Okay.
Try not to break it. So if you're doing this all day, it doesn't fire your rotator cuff.
Yeah.
Right when you cross the plane, get my glasses, or reaching, it fires your rotator cuff. So at nighttime, most people have their arm under the pillow like this.
Oh, yeah.
So I always have them try to hug a pillow low. So nighttime pain, pain with reaching above, overhead, or behind are classic kind of signs of a issue if it's repetitive and it's going on for a few weeks.
Mm-hmm.
So,
and these aren't just sports injuries like we were talking about, maybe playing softball. These are just everyday things that can really cause people a lot of pain. So what should we do if we need treatment, or how do we know when we need to go and actually get real treatment for this?
Initially take an inflammatory, like take 2 Aleve twice daily if you can, or ibuprofen, usually for adults 600 to 800 milligrams twice daily, and do some what I call passive range of motion exercises. But if it's a repetitive pain going on for weeks and weeks and weeks, getting worse, I can't do things I want to do, I can't play the games I want to play, probably need to get looked at, because some people need some steroids or injection or maybe some therapy to help rehab it, or it can go on for quite some time.
And unfortunately, it could lead to surgery. We're seeing a lot of those these days.
Some people need surgery.
Some people need surgery down the road. Hey, real quick before you go today, I know you guys have a new physician joining you at the clinic in Sherwood. Who is it going to be?
John Brown. So John Brown started last month. He was in Cabot, Jacksonville area, so it's good to have him in our realm, because we needed help. Known John for 15 years plus, so good guy. Glad to have him, and he's call if you need an appointment.
There you go. Number on
freely
your screen.
available. And anyway.
All right, wonderful. Welcome to Dr. Brown, and thank you again for coming in, Dr. Ballard. Always good to see you, sir.
Thank you.